This is a short video of a L5-S1 disc herniation step by step. Remember, the position of the patient is the same prone position you use for an open approach. So we start with an AP X-ray to mark the level. Remember to mark the skin incision in the middle of the flavum ligament, 2 or 3 millimeters away from the midline. The next is the 5 millimeter skin incision. Cut also the fascia and introduce the dilator. Feel the resistance of the flavum ligament in the depth. Control the position of the dilator with AP X-ray, and remember it must be in the middle of the flavum ligament. Then introduce the sleeve of the endoscope with the opening of the sleeve to the medial line, and switch to the lateral view with X-ray to confirm the orientation of the dilator, which is pointed to the disc. Introduce the endoscope and prepare the muscle and expose the ligamentum flavum. You have to push all the time the sleeve to keep away the soft tissue and to stretch the flavum ligament. So open the flavum ligament from medial to the lateral aspect until you reach the bony border of the ascending facet. Once you reach the lateral recess and you are lateral to the neural structures and you decompress the lateral recess, you can descend the sleeve of the endoscope and rotate it carefully in order to protect the nerve and to expose the disc herniation. Once you are in front of the disc herniation, the next step is to remove it carefully. If the sequestered material is too big, you will need to remove the endoscope, keeping the sleeve in position. You remove carefully all the sequestered material until you decompress the nerve and the neural structures. At the end, you make a final inspection of the decompressed neural structures. You will remove the endoscope and close the skin with a single suture. The patient will be discharged a couple hours after surgery and will be able to work just 3 days after the surgery and to start the rehabilitation 1 week later.